All right, this is exciting and very, very interesting for anybody, particularly if you have back pain. And you know somebody who does. Doctors over at UCSD are using some innovative techniques and basically what they're using is robots. And it's quick. Apparently, the recovery time is faster. And Dr. Choll Kim is here to explain about this surgery and that it used robots. Good morning.
Thank you for having me.
I think a lot of people say, wow, you're using robots to do surgery. This is kind of a cool, innovative thing. But I guess robots have been around for a while.
They have both robots and technology like GPS and computer navigation, and we utilize all those technologies to try to make surgery with smaller incisions and try to minimize trauma. And
yeah,
it's working out very well.
All right, you've actually brought in a model here that we're going to look at in just a minute, but we have some video as well, and we wanted to show, we actually took pictures of you doing the surgery, and we wanted you to sort of explain the tool that you use, how it is robotic, and how it actually helps people. Here it is, and what are we looking at here?
We're looking at some virtual images of the spine there, and we do a lot of the surgery both looking at the patient as well as the monitor, and that's a special tool that has a navigation tracker, and that allows us to move that instrument in three-dimensional space and know where we are. So we can move that instrument, for example, and point to the exact location of the surgery and make very precise incisions and try to get to where we need to get to through very small incisions.
Oh my goodness! So part of it is, and that was a little disturbing there, but part of it, not being a doctor.
You get used to it after a
while.
while.
Yeah, you get used to it not being a doctor. Anyways, but so part of it is humans and doctors, and part of it is robotic.
Absolutely.
Yeah.
It's more computer-based than robotic, but a big component remains human, and you still have to be a spine surgeon to do the surgery properly and safely.
Yeah. All right. Now, show us on this exactly what you would be doing in the case of that. Like, let's say somebody has a bulging disc or a deteriorating cartilage.
The idea of minimally invasive surgery is that when we do an operation like that, we're only operating on a very small portion of the spine. So instead of making a big six-inch incision to try to get all the instruments in there, we just make a very small incision precisely over the surgical site, and we use all the different equipment that we have at our disposal to make that surgery very safe. So we may be operating right here or right here. This model has a little fake bulge, and you can see that's only the size of a quarter.
Right.
Well, you don't need a 6-inch incision to operate on an area this small.
Makes sense to me. So who would be a good candidate for something like this? Obviously, there are a lot of people out there with back pain, but not all of them need surgery.
Well, most people that have back problems do not need surgery, so that's the first thing.
That's good to know.
Surgery should be avoided whenever possible, but if you do need surgery, if you can do it minimally invasively, it's an advantage. About 2 or 3 years ago, most of my patients still needed open surgery, but over the last year or two, the technology has gotten tremendously more advanced, and now I would say most of my patients benefit from some sort of a minimally invasive surgery. But the people that ask me a lot about it are younger patients that are very, very active and need to get back to work, need their recovery to be expeditious.
And the recovery time is a lot faster.
It is tremendously faster.
Yeah.
It's dramatic.
Wow. All right. Well, very, very exciting. And if you want more, you can, of course, contact you over at UCSD.
Right.
Or you can go to our website. We'll give you a link to get more information on that. So, Dr. Choll Kim, thank you so much
Thank you.
for coming in. We do appreciate your time. And very exciting for those people who have back pain. I'm among them. Fighting it for years, but hopefully no surgery. Ever.
Absolutely.
All right. Doctor, thank you so much. All right. Let's say good morning to our buddy Rod Luck, who's getting in shape. Hopefully won't need any back surgery.